Welcome to the Pediatrics Kids Covery class, dear doctors. Myself, Dr. Parv, and we are studying Pediatrics. So this is the time when we discuss about the pediatric infections, and the overview for the infectious diseases is first of all we'll discuss about the Bacteremia and Sepsis. Then we'll discuss about fever of unknown origin and torch infections. Then we'll have a discussion on epiglottitis, tracheitis, retropharyngeal abscess, cervical lymphadenitis, pertussis, measles, rubella, erythema infectiosum, roseola infantum, varicella, and mumps. Okay, so starting, all right, and we have some more diseases also like hand, foot, and mouth disease, herpangina, botulism, as well as scarlet fever. Starting with the basic discussion of what do you mean by bacteremia and what is sepsis. So see, neonatal sepsis is actually a clinical syndrome. Neonatal sepsis, of course, neonate is going to have sepsis. It's a clinical syndrome that is going to manifest with the signs of infection, and there will be some or the other bacterial pathogen will be associated, and bacterial pathogen can be isolated from your blood. So basically matlab bacter, bacteria, and emia means coming in the blood. So neonatal sepsis is a clinical syndrome which is going to manifest with the signs of infection, and of course there will be bacterial pathogen that will be discovered from the blood, right? So if you know about the neonatal sepsis, there are two types. First is going to be early onset sepsis, next is going to be late onset sepsis. So early onset sepsis means that it is going to take less than 7 days of the age, and late onset means that the child is now more than 7 days of the age. Okay, so early as well as late. Now coming on to the early onset. So the mode of transmission of early onset sepsis is mostly vertical transmission. That means that is coming from vertical, means from the lower genital tract of the female, and it's going to infect the child, or in fact the infected amniotic fluid can also cause the infections, right? So this is the early onset. Next is the late onset. So late onset means you will be having a history of contamination, like the contact with the environmental sources or caretakers. Okay, so they must be having the same disease as the baby is suffering from. Okay, so this is how we are going to differentiate between the early onset and the late onset. So the most important thing, please understand that in early onset, the things the most most common causative agent is actually group B streptococcus and E for what? E for E. coli. Okay, so group B streptococcus and E. coli, both of them are responsible for causing both the early as well as the late onset. But nowadays there are increasing incidents that in late onset Staph aureus is also increasing. Okay, our pediatric faculty in my college, she used to say that from where the baby is getting the infection, these are the hands of the consultants. Okay, so there's a lot of Staph aureus roaming here and there, and that's why the late onset neonatal sepsis is the cause is the Staph aureus, but then in the early. Okay, so my father always teaches us be early. Okay, be early. Okay, rise up early. So be early means group B streptococcus and E for E. coli. What are the risk factors? Say in prematurity, of course, the child is not having sufficient immunoglobulin, so the child will not be able to fight the infections. So prematurity is one of the cause. Next is premature or prolonged rupture of membrane. Okay, so in both of the cases, rupture of membrane, the child is not going to have what? The child is not going to have a protective layer outside. So if there is no protective layer outside, the child is going to have a neonatal sepsis. So what are the common findings? Just like any other sepsis, the fever is going to occur. Okay, so if they ask you like what is the most common finding in a term infant, that's going to be fever. But what is the most common finding in a preterm infants? That's going to be hypothermia. So how to remember? See, hypo means less and pre are actually same word. So preterm, hypothermia, same thing. What are the other things? So jaundice can occur, respiratory distress can occur, hepatomegaly, vomiting, lethargy. These are actually the generalized signs, not very important, but yeah, many of the infections are going to affect the liver, so that's why jaundice will be seen. That's why hepatomegaly is going to be seen. Okay, coming on to the next part, what will be the laboratory investigation? So of course, to arrive at a definitive diagnosis, you have to do blood culture. CBC is going to show you elevated WBC count. Urine culture is also performed after 5 to 6 days actually. So how to remember? Remember URINE, 5 words, okay. So after 5 to 6 days, it is advised that urine culture should be done. And of course the site culture, like for example, if the eyes are having some discharges or something, so the site culture is important, okay. The site culture is important, okay. So just remember the mnemonic, like you should know that what all investigations are being done, okay. So what happens is, although you have a long list of investigations, you can perform anything, but an MBBS graduate, a doctor should know that, okay, what are the most common etiologies. That's why you should be able to tell the patient that, okay, go and do these investigations, because common things should be in your mind first, okay. So what are the common things? So remember this: BUS. Okay, so B for blood culture, U for urine culture, S for site culture, and of course the most common everything, CBC. Most common out of everything is CBC. Lumbar puncture. See, if you are having the signs of meningitis, like the child is having altered consciousness, okay, if the child is not able to maintain eye contact, okay, sometimes they give you a history, the child is not maintaining the eye contact. So in all these cases, we have to do a lumbar puncture. Yes, X-ray is suggestive if the child is having respiratory distress, but the treatment, please remember that if the child is having sepsis, we give the bottle of ampicillin and gentamicin, okay, ampicillin and gentamicin. We can add cefotaxime if meningitis is suspected. If we can add vancomycin, if Staph aureus and catheter related infections are catheter related infections, not cowty in neonates, but then catheter related infections, okay. And then clindamycin is given if there is a GI anaerobic infection is suspected. So please remember AG, OG, Logi, Sunoji. That's a beautiful Bollywood Hindi song. So AG, okay, it's a AG is a song, and AG is something when a child is born, AG, that means the dad is going to be the dad. So you can remember that this is the drug which the dad brings, A and G. What is AG? Ampicillin and gentamicin. Easy to remember. Next is, you have to remember cefotaxime. So this is M, this is E, this is M, this is E. So cefotaxime is for meningitis if it is suspected. Next is vancomycin. So vancomycin, vanco, C for catheter. Okay, C for catheter, and C and S are phonetically very similar, so Staph aureus as well as catheter. And I always say that C and G look similar, so G for GI and C for clindamycin. So clindamycin given for GI anaerobic infections. Yes, see, if the cultures are negative after 48 hours and the infant is well appearing, then we can discontinue the antibiotic. This is not a risk factor, sorry, I've written it wrong. So this is not a risk factor, but just to tell you that if the cultures are negative for 48 hours, after 48 hours, if the cultures are negative and the infant is well appearing, then we can discontinue the antibiotics. Okay. So thank you so much for joining the lecture, but I want you to ask a simple question, like how much time is required? Okay. How much time is required to tell that if the patient is having early onset or late onset sepsis? Like for example, if it is a 2-day baby, then you can call it as early, or 3-day baby. So this is my question to you. So if you want to label something as early or late onset sepsis, how much is the time limit required? Okay, so I'm leaving you guys with this question. I will wait your reply in the comment section. Thank you so much. God bless you.